Welcome back. I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. And my next guest is Ron Friedman, eye surgeon. Dr. Friedman, thank you very much.
Thank you for having me.
It's a pleasure to have you here. Dr. Friedman, you know, there's a lot of allure and kind of a lot of mystery around that term eye surgeon. I mean, it sounds like it's very sophisticated and it requires excellent hands and excellent vision, etc. Tell us a little bit about that. What's it take to be an eye surgeon?
Well, basically, we train first as physicians. We do our 4 years of high school, 4 years of medical school, and then we go into a specialty program, which is usually a minimum of 3 years for general ophthalmology. Many of us then go on to an additional year of subspecialty training if we want to do surgery that is on the cornea or on the retina or on the eye muscles. And it's a total of about 12 years after high school before you finally get out and are allowed to perform general eye surgery.
So, Dr. Friedman, I recall from my training that eye training or ophthalmology residency is one of the toughest specialties really to get into. It's very competitive.
Well, it was 25 years ago when I finished my training. I remember having wanted to go to a whole host of institutions and was accepted into one or two that were not necessarily my choice, but I was happy to at least get into the profession. Ophthalmology has the benefits of being a relatively clean profession. We have very little night and emergency call, and we have a tremendous number of procedures that give patients improved vision and great satisfaction. So it's a very upbeat profession, somewhat like plastic surgery.
Well, it's actually remarkable. So Dr. Friedman, in your estimation, who are the good medical students that go into eye surgery? Like, in other words, what's it take to be a good eye surgeon?
Well, interestingly enough, it takes someone like yourself who's interested in music and interested in detail, because we're very detail-oriented. A lot of the students that choose ophthalmology have an affinity for math, because we deal with a lot of numerical issues, the measurements of the eyes for either glasses or implants or the vision correction surgeries are all very numerical. And as you know, that there's a tremendous overlap between mathematics and music. So we find, especially on the West Coast, a lot of the Asian Americans medical students choose ophthalmology because they're very numerically and technically oriented. It's not as much of a descriptive practice as other areas where we would be describing various conditions of organs, different sounds. It's certainly not a very audible practice. It's a very visual and very numerical specialty, so it attracts those who have that affinity.
Right, and it sounds like one of the key phrases I heard was detail-oriented.
Oh, absolutely.
I think typically the eye surgeons are very exacting, very meticulous, and I think you have to be.
Absolutely. Fortunately, our surgeries are not a great length. Our average eye operation is about 10 to 15 minutes, which of course varies tremendously from the from the large number of hours that many other surgeons spend in the operating room. But during that period of time, the attention to detail and step-by-step performance of each procedure is very demanding. It also requires a fair bit of eye-hand coordination, because at any given time when I'm operating, I'm using both my eyes to have three-dimensional vision. I'm using both my hands with instruments, and I'm actually driving a microscope and a machine with one foot and the other foot. So I've got 2 eyes, 2 hands, and 2 feet working together.
Right.
So it's a good thing it's not too long, because it would be taxing if you had to do that for a couple of hours.
I understand, but it certainly is technically demanding and
Yes.
requires good eye-hand coordination.
Absolutely.
And attention to detail.
Mm-hmm.
So, Dr. Friedman, before we go on, there's a few specific procedures I want to ask you about that are common. But before we go on, let's talk about the difference between an ophthalmologist, which is an eye surgeon, and an optometrist and an optician. Can we describe for our viewers the differences?
Absolutely. Optometrists are licensed to diagnose and prescribe glasses, diagnose medical conditions and surgical conditions of the eye. They're not allowed to do surgery in California. There is some variations between states in these laws, but in California they're not allowed to perform surgery. There are a limited number of medications they can prescribe for common infections, common inflammations. Generally speaking, they do not manage glaucoma, they do not manage retinal disease, they do not manage cataracts. They have a training that is very different. They go to 4 years of college after their high school, and then they go to a school of optometry, which can be 3 to 4 years, but they don't become medical doctors. They don't spend the years devoted to general medical diseases, anatomy and physiology in the same depth that we do. And they don't have to go on to internship and residency training. So it's a much more abbreviated a trip than it is to become an ophthalmologist. Now, an optician is someone who is licensed or trained to fit and manufacture glasses or contact lenses. So they will take a prescription that is generated from either an ophthalmologist or an optometrist, measure your eyes for a frame or for a contact lens, and actually assist you in selecting those goods and find something that allows you to see comfortably. Now, both optometrists and ophthalmologists have opticians, so it can be confusing that work with us.
Well, oftentimes, won't ophthalmologists and an optometrist and optician sometimes work together, or at least in
Absolutely.
the same complex?
Right. There's multiple combinations that are possible. In this community, in Monterey specifically, we don't have any practices that incorporate optometrists and ophthalmologists. But in larger cities, it's very common to have a large practice composed of both opticians, optometrists, and ophthalmologists.
Okay. That's very helpful, Dr. Friedman. Now, there are a couple of areas that I would like to address specifically, or a couple of general procedures. The first procedure that I'd like to talk about, or the first group of procedures I'd like to talk about, or have you talk about, is the new vision correction procedures. If we can kind of back up and talk about the person, let's say, who has spectacles, glasses, or contacts, what of those people, who can consider vision correction surgery?
Well, it's a very, very large area of our specialty, and I consider myself a specialist in that area, having dedicated myself to learning and adopting those procedures and bringing them to Monterey since 1991. They began with radial keratotomy, a procedure that was originated in Russia, and then went on to the laser procedures that came in the United States in 1995. Now, we started with procedures for nearsightedness. That's people who wear glasses, usually younger people who can't see far away. And now we've gone on to people who have the need for glasses for reading and are farsighted. And now we have people who can be corrected who just have astigmatism. So after 13 years of laser procedures, we really can correct almost everybody if they have a desire to relieve themselves of dependence on glasses or contact lenses. Now, having said that, the number of people that actually undergo these procedures is only a small number, maybe 10% of the population, because many people don't mind wearing glasses and don't mind wearing contact lenses. But 10% of the population is still a very large number of us patients to take care of.
Well, Dr. Friedman, you know, this area is fascinating to me, and I recall when I was at the Naval Academy at Annapolis, you know, a lot of us considered going into pilot training or submarine training or destroyer training, etc., and so they were just developing protocols for the midshipmen who needed glasses or corrective lenses to have vision corrective surgery, so then they could go into pilot training. So is that all worked out now? Is that pretty clear?
Well, the military still treats a lot of their enlisted men. They've realized that obviously having good uncorrected vision and not being dependent on glasses is important for field soldiers, Marines, pilots, and they do a lot of training of them for their various specialties. So it's less expensive to treat them with the laser than to retrain another soldier. So historically, the Navy, especially in San Diego, has had a very large program for doing laser surgery on its enlisted men.
I see. So let's again back up and say you talked about radial keratotomy. That's called RK, and you talked about laser treatments. Are there other treatments now? Are there other vision correction surgery?
Yes, there are, and there will be even a few more tomorrow than we have today. Most recently, we've also adopted the use of implants, in addition to the laser treatment, where we are using a laser to reshape the top surface of the eye. We have multiple different types of what we call lens implants. Some of them look just like contact lenses. Some of them have more elaborate shapes, where we can insert a lens inside the eye, not on the top of the eye like a contact lens, and the person has corrected visual acuity. We even now have bifocal implants where in someone who's over 60 or 65 years of age, if they want to see far and close without their glasses, we can put in a bifocal implant. And the success of those is improving every year.
You know, that's actually, it's amazing to me. So you can insert a lens behind the cornea, it's behind the cornea, in the eye, and so that corrects someone's vision, and that's inside the eyeball.
Correct. And another beauty of it is it's actually a reversible procedure. If for some reason someone didn't like the lens, we could take it out and put in another one in its place.
I see. So Dr. Friedman, describe, if we can, what the procedure's like. They obviously they make an appointment to see you. You're in Monterey.
Yes, right
now,
downtown.
Is that procedure done under anesthesia, under local? Is it done in the hospital?
Well, almost all our procedures are done in a remarkably similar way. There are some that require the use of an ambulatory surgery center, like the one that we have, and there's the laser procedures are generally done in the office. And it depends on the degree of sterility that we need to maintain for the procedure. From the patient's perspective, all the procedures mean lying on your back with a little bit of sedation and gentle local anesthesia for anywhere from a 10 to 15 minute time span.
Okay, so can we just summarize for our listeners and viewers, like who might consider laser and who might consider an implant to correct their vision?
Well, most patients when they come to see me really don't know what they need. They have an idea of what they want. And what they want is they want to A, improve their vision, B, buy themselves some independence from whatever optical goods that they're using. And it requires an examination of the eye, but also an examination of what someone's objectives are, what they do for a living, what their hobbies are, and what they would be satisfied in seeing without glasses. Some people have much more demanding lists than others, and generally speaking, we have to weed through that and decide what is most appropriate. And it's often a judgment call on the physician, because a person coming in may be eligible for several of these different corrections.
I see.
And they're not in a position to make a choice. I have to advise them which I believe is the correct procedure and then take them through it.
Well, that's fascinating, and it really is amazing what you guys are doing with lens implants, etc. Dr. Friedman, another area that I want to touch on briefly, of course we could talk for hours about any of these subjects, is cataract surgery. Now, could you define for our listeners and viewers, what's a cataract, really?
Well, I wish I had a picture to show you here, but if we looked at the eye as if it was a camera, the lens of the eye, inside the eye, becomes cloudy as we age. Very few of us escape that because we've learned to prolong life beyond the point that the lens in the eye can remain its clarity. So as the lens becomes clear, we often use the ability to make out golf balls or see street signs, or we have glare or halos driving at night, and these are the typical symptoms that people have with cataracts. Very often people are not even aware that they're losing their distance vision until they have that obligatory trip to the Department of Motor Vehicles and they fail their vision test, and they're sent over and we find out that they indeed have a significant cataract. So when the lens is cloudy enough and the patient wants to see better, we bring them to our ambulatory surgery center. And again, in a 15-minute procedure done under just modest anesthesia, we take the cloudiness out of the lens and put in a clear lens, another type of implant that we insert to restore the vision in the eye.
Okay, so again, now is that done under local or a general anesthetic, or do they have a choice? How's that going?
Almost 95% of the time it's done under a local with minimal sedation. Only under certain circumstances where someone is unable to cooperate, have some mental incompetency, or some other neurological problem do we have to put someone to sleep for a cataract operation these days.
Now, Dr. Friedman, you know, I hear my patients, they use this term called like a cataract is ripe or not yet ripe. Does that mean it's early or not requiring surgery?
Well,
what's that mean?
The term ripeness probably is a 50-year-old to 70-year-old term, and it would describe a cataract that would become mature, where it would completely block out the light, so the eye was essentially blind. Many third world countries still have a lot of those cataracts floating around. In the United States, where our visual demands to drive a car, to use computers, to write checks and to read our bills is so demanding, no one waits for a cataract to be ripe. It's a question of the vision being blurry enough that the person is not functioning to satisfy all their daily visual demands.
Okay, so who should come in for an evaluation? Is it dependent upon the person just noticing that their vision is not so good? Are they referred to you by the optometrist? Can people call you directly to make an appointment? How's that work?
All of the above. I have a good relationship with a number of optometrists who don't perform surgery, so I do get quite a few referrals from local optometrists. And many people come in because they just want to see better. They've realized their vision's getting weaker, and it may be from age or it may be from another disease, and they need to be evaluated and diagnosed. And that's what we do.
So I just want to make sure before our program concludes, you practice here in Monterey, and your number is 375-2486. 375-2846, and you're Dr. Ronald Friedman. Now, do you have a website, or if people want to learn more information?
Yes, we do. The website is called friedmaneye.com. It's pretty easy to remember. And we're constantly updating it, introducing all the new procedures that we have.
Okay. Now, you talked about in the cataract operation itself, you actually can remove the cloudy lens and you put in a new lens. Is that a human lens? Is it a plastic lens? I mean, what's that?
It's a plastic lens. Most of these lenses now are made of a very high quality plastic, either an acrylic plastic or a silicone plastic. And a question that I always get asked is, does that lens ever need to be changed? And I tell them no, because it's going to outlive every other part of your body, except for maybe other prostheses that have been implanted.
Now, Dr. Friedman, typically do people have a cataract in one eye or both eyes if they're going to get cataracts, and do they have them done at the same time or one after the other? How's that?
It varies, but most people who have developed cataracts have them in both eyes. And because most people enjoy the results so quickly in the post-operative period, that we often end up doing the other eye within a week or two. There's a rare instance where someone, often a diabetic, will develop a cataract early in one eye, and then there's a lag period of maybe even several years before developing the cataract in the second eye. But most people, once they realize the rapid and painless vision improvement, can't wait to get their other eye done.
Okay. Is there a typical age at all that a person may develop a cataract, or does it vary greatly?
Generally speaking, there's the most common type of cataract is what we'd call the age-related cataract, and that normally starts at about age 65, but doesn't usually bother people until about age 70 or 75. However, there is a whole host of other diseases, including diabetes, that can cause cataracts to occur at a younger age, even in the 40s and 50s. So it's not uncommon that I'm doing cataract surgery on people my age or even younger than me on a weekly basis now.
Well, Dr. Friedman, I tell you, it's a fascinating area to me. This business of being an eye surgeon, it's got a tremendous amount of allure, and I understand why that's true.
Not too late to go back.
Well, we'll see about that. Thanks very much for being here, Dr. Ron Friedman.
Oh, my pleasure.
I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. Thank you very much for being here, and please tune in again every Monday at 4 o'clock. Thanks very much. So, great to have you here.
Good.
Thanks very much.
That was fun.
Now, I think that
We'll be back